1 in 8 women will get breast cancer. Many choose to have a mastectomy, but thanks to medical advances, there are other options out there today.
And it is Breast Cancer Awareness Month, so we are doing our part to raise awareness. So joining us this morning to share her story is Zane Stumbers. She had preventative surgery to reduce the risk. Her surgeon, Dr. Oren Lerman from Northwell Lenox Hill Hospital, is also here. So good morning to both of you, and thank you so much for being here.
Good morning.
Good morning.
Well, Zane, you actually have cancer that runs in your family, on both sides of your family, right? So you took preventative measures early on. Can you talk about when you started getting mammograms?
The mammograms came after I found out that I was BRCA2 positive. And I found that out once my aunt tested positive for the BRCA gene. So I would say that I screened instead of opting for something like surgery for 7 years, right? So that was every 6 months, going for MRIs, mammograms, etc.
But it was quite the journey, right? I mean, you were living in California at the time before you had the mastectomy and had your ovaries removed, right? So you went from California to New York. Talk to us a little bit about the journey and the decision to do so.
Sure. I decided to do a lot of research. So I work in nursing education, and I interviewed 7 surgical teams before deciding on Dr. Lerman. It was really important to me that I have a nerve allograft option, and I also wanted to feel like me the most, right? And so breast implants are fine, but there are other options, and this uses your own tissue to create breasts. So there's no plastic in my body. And also, again, that resensation part was very, very important. They don't really tell women that after these surgeries, you cannot feel a shower. You cannot feel a hug. You cannot feel your clothes, right? And I wanted to ensure the best chances for being able to do that.
And Dr. Lerman, that sounds like a very complicated surgery.
It's definitely the most advanced type of breast reconstruction that you can have after mastectomy. And I think that Zane just explained it very well. So it took her a long time to figure out what kind of reconstruction she wanted. And you really have to do the research to know that there are different options. And this type of surgery takes a lot longer and has a lot more moving parts to it. So it's a much more advanced operation.
It's a series then of surgeries, or is it one?
So most of the time when we're doing breast reconstruction, it's a series of surgeries. It can take 1 or 2 stages. In Zane's case, 3 stages.
Yeah.
Okay. But the goal at the end is to really make you look as good or possibly even better than you did before, because we want to restore you, but we also want you to look as good as possible.
And have the sensations that she was talking about at the same time, right?
Right.
And so then there's the recovery process after it. So for folks who are thinking about, okay, what does that look like? Walk us through that.
It's long, but I felt very, very supported at Northwell by everybody. From the moment that I walked in for surgery, frankly, all the way through the hospital stays and with my appointments, follow-up appointments with Dr. Lerman. So exercising, right, eating well, taking care of yourself, all of those things are really important for a good recovery.
And the recovery process and your relationship with the patient, that takes a whole team of doctors, or doesn't it?
So in Zane's case, we had a team of at least 4 or 5 doctors from 3 or 4 different specialties, including breast cancer surgeons, GYN oncologist surgeons, the plastic reconstructive surgeons, which is myself. And we did all of this together over the course of about an 8 to 10 hour operation.
Wow.
And we had to coordinate these 3 or 4 different teams together.
So can you walk us through the mammogram process, right? And then there's, because Zane took it one step further to get the BRCA screening, and not everybody does that. Can you kind of explain that?
So if you have a strong family history, if you have more than a close relative, if you have a relative that has had breast cancer at an early age, all of these things, or possibly a relative that had ovarian cancer, all of these things are clues that maybe you should get tested for the genetic predisposition or the BRCA gene.
On top of your mammogram.
On top of your annual screening. And when you get tested for it, it could indicate that you have a significantly increased risk, up to 60, sometimes even up to 80% risk of developing cancer over the course of your life.
Was it easy for you to make the decision to go the route that you did, or did it take some time for you to decide?
It took a lot of time, yes.
Yeah.
So I found out that I was at about a 75% risk for breast and about a 30 to 40% risk for ovarian. And there were 3 ovarian cancer deaths in my family,
Oh, my
the
goodness.
last one being in May of 2022. And
Sorry.
that really, thank you, but that really galvanized me to take more serious action, and I'm really glad that I did.
Yeah. So what do you want women to walk away from with the idea of preventative rather than waiting to see?
Sure. Well, the thing is that the BRCA gene and other genes, they're actionable now, right? So what that means is sometimes some of these genetic tests give you information that you can't do anything about it
Yes.
yet because there aren't treatments. But
Okay.
with this, I reduced my risk from 75% to less than 5%. And the average woman has about an 11% chance of getting breast cancer in her lifetime. So knowledge is power here. And I feel very empowered to, just in general, I mean, when you make a decision like this, there's no more storm cloud following me around. And I feel that I just need to live my best life, empowered and happy to be here, and it's great.
How are you feeling?
I'm feeling great. I'm
good.
pursuing dreams.
Oh,
It's
that's
really good. I'm
wonderful.
back in New York. so,
Yes.
yeah, very happy.
Well,
Very
thank you
good.
so much for sharing your story.
Yeah.
It's great to have you
Yeah.
both here.
Thank
Thank
you.
you guys for
Dr.
having
Lerman,
us.
yeah,
And thank you,
very
Dr. Lerman.
Appreciate it, of
Yeah.
course.
Yeah. These are the relationships we love. It's so important to see that healthy relationship with doctor and patient that every step of the way. Speaks volumes to you as well in the hospital, so thank you.
Thank you guys both.
Thank you.